Hi guys, and welcome to another video. In this video we're going to learn what are allergies and what we can do to help our patients if they have an allergy attack. Let's start. Okay, so what are allergies? Allergies is an overreaction of our immune system to something that is quite harmless. So for example, if a virus enters our body and our immune system reacts to that, well then that's a really good thing. Our body is trying to defend itself. However, if we ate a peanut, for example, and then our body is trying to really strongly defend itself from that peanut, well, that is also what we call an allergy. It is an overreaction of our immune system to something that is harmless. Okay, so some common signs of an allergic reaction can include rash on the skin, itching, a runny nose, sneezing, nausea and vomiting. It can also include swelling, fast pulse, and even changes in the consciousness level. Now keep in mind, the signs of an allergic reaction can vary really greatly between person to person. On top of that, these signs can sometimes develop very quickly in a matter of seconds, and in other times it can take around an hour, up to an hour from the moment of the exposure until these signs are developed. In most situations, allergy is not life-threatening. However, there is something that is called an allergy attack or anaphylaxis, which is when our body really severely overreacts. And when our body really severely overreacts, then it can definitely be very life-threatening. Now, the main dangers of an allergy attack is choking as a result of swelling, a blockage in the airway, or a narrowing in the airways, like in an asthma attack, as well as a very severe drop in blood pressure. If that happens, then, well, our patient won't get enough oxygen to all of his cells in the body, and especially the brain, as well as sugars. It is really important that we will be able to decide if our patient has just a normal allergy reaction or if he has an allergic attack. And the way that we will consider an allergy an emergency is if, one, the reaction is very severe. So for example, our patient is really swelling or he lost his consciousness. 2, our patient has difficulty breathing. 3, if different systems of the body are involved. So for example, if our patient has a rash as well as vomiting. Those are completely two different systems. And 4, if we are unsure and we see signs that worry us. It's always better to be safe than sorry. Okay, now for the treatment. The first thing we want to do is obviously to call for help. The second thing is we want to make sure that we take our patient away from their allergic trigger. We can't always see what is exactly is triggering their allergic reaction, but if it is possible, we should really try to take our patient away from that trigger. Then, if we realize that it is a very severe allergic reaction, then we should, if our patient has it, then we should encourage our patient to use the EpiPen if he has one. After that, we should monitor their situation while waiting for the ambulance to arrive. It is especially important to monitor their airway while doing so. Now keep in mind, in some situations, we are the people who are going to use that EpiPen syringe in order to help our patient. Okay, so the way that we administer an EpiPen shot is, well, first let me show you my shot, kind of. This is a pen. The reason why I'm using a pen is because an EpiPen shot is really simple. You just take the cap off and it is completely automatic. So after you take the cap off, you can just hit it on your patient and it will administer the shot. Okay? Now, the place that you want to administer the shot should be on the upper outer side of the thigh. Okay? So it's actually pretty easy to find it. All you want to do is you want to split the thigh in 4 sections and then take the outer section, take the cap off and hit it and that is basically how you use an EpiPen shot. Obviously, you should do this below the clothes. Okay, and that is it for this video. You now know how to treat allergies as well. I hope you enjoyed, and as always, I'll see you in the next one. Bye guys.